The use of left ventricular assist devices, LVADs, are increasing in the management of advanced heart failure. The LVAD is implanted in the left ventricle. The LVAD is powered by a driveline that connects the LVAD to battery or AC power outside the body. Meticulous care of the driveline includes daily assessment of the site and sterile dressing change. Although technology has improved over the years, driveline complications continue to develop in up to 20% of all implanted LVADs. Driveline infections are associated with significant morbidity and mortality. The driveline can be cumbersome for the patient. Using an anchor device is essential to prevent pulling or tugging on the driveline that would cause trauma to the site. Trauma at the driveline site breaks the driveline away from the skin and creates an open wound. An open wound at the driveline site creates the need for thorough sterile dressing changes to prevent infection. Driveline infections can occur at any time after the device insertion. Late driveline infections have been associated with additional hospitalizations, the need for reoperation, an increased risk of stroke, and a delay in heart transplantation. Our goal is to eliminate driveline infections in the first 90 days and significantly reduce driveline infections in the entire LVAD population. Prepare the environment. Make sure the room has a flat surface before starting the dressing change process. Close any open windows and turn off ceiling fans if the patient is at home. Make sure doors to the area are closed and pets do not have access to the dressing change area once the sterile field is opened. Clean the flat surface before starting the process. Perform hand washing before opening the dressing change kit with soap and water. Open the plastic cover of the LVAD dressing kit and place it on the clean, flat surface. Apply the mask and the bouffant hair protector to yourself and the patient. Put on clean gloves. Open kit carefully. Grasp the tip of each corner to pull the drape out so it is flat. Place the bottle of polymyxin drops a few inches away from the open kit. This bottle is a multi-use bottle that should last for approximately 60 to 70 applications and should be sent home with the patient. While in the hospital, the polymyxin bottle will be kept in the room lockbox. Remove old driveline dressing. Inspect the site for drainage, redness, and swelling. Notify LVAD team if any abnormal findings like redness, drainage, or swelling or pain occur at the site. Remove the driveline from the anchor device. Hold the driveline in a high arch as you assess the driveline site. Gently lay the driveline down and discard the gloves and use a hand sanitizer in the kit to wash your hands. Remove sterile gloves from the kit and put them on. Remove the white sterile drape and unfold on a flat surface between the patient and the kit. Place the items from the kit onto the sterile drape in the order they will be used. The 3 ChloraPreps are placed closest to the patient in the first row. In the second row, place the 4x4 gauze, drain sponges, and skin prep pads. Place the 2 single 4x4 gauze on the styrofoam tray. In the third row, place the LVAD outer dressing and the closure piece. Take the cap off the sterile water and place 5 milliliters, which would be half, on each of the gauze pads. This is for the rinse. Throw away the syringe. Cleaning of the Driveline site. Gently grasp the Driveline approximately 6 inches from where it exits the skin. Create an arch with the Driveline that is 2 to 3 inches above the skin. Press and hold the Driveline against the body to prevent pulling on the Driveline throughout the cleaning, rinsing process. Activate the ChloraPrep applicator. Use the ChloraPrep to clean the skin starting at the Driveline. Using a gentle friction scrub, move outward from the Driveline in an arch over half of a pie area. Throw the first ChloraPrep away and pick up the second ChloraPrep. Clean the second half of the pie area in the same manner as the first. Throw away the second ChloraPrep. Continue to secure the Driveline against the patient's body. To rinse the site, take 1 wet 4x4 gauze and squeeze it to remove most of the liquid. Do this over the styrofoam to prevent wetting the sterile field. Wipe the skin of the first half of the pie area, starting an inch away from the Driveline in an arch. Throw away the gauze. Pick up the second wet gauze and squeeze the gauze to remove most of the liquid. Wipe the skin on the second half of the pie, starting an inch away from the Driveline. Keeping the hand that is holding the Driveline pressed against the patient's body, use the third ChloraPrep to clean the underside of the Driveline from the exit site almost to your fingers. Lay the Driveline almost flat. Clean the top side of the Driveline from the Driveline exit site almost to your fingers. Move the ChloraPrep from the exit site to your fingers as many times as it takes to wet the entire surface of the Driveline. Allow skin and Driveline to dry completely, at least 90 seconds. When skin and Driveline are dry, open the bottle of polymyxin. Hold the bottle 3 to 4 inches above the Driveline site and allow 4 drops to fall on the exit site. Allow to dry at least 90 seconds. Use of the antibiotic drops is associated with a 75% reduction in Driveline infections, a 95% reduction in deep Driveline infections over a period of years at other centers. Applying LVAD dressing and anchor. Take off sterile gloves and put on the second pair of sterile gloves. Pick up Driveline and place it in a high arch again, and using just your sterile hand, place the split drain sponges around the Driveline. Place 1 or 2 4x4 gauze on top of the drain sponges. If there is moderate drainage, use all the remaining gauze on top of the drain sponges. Use skin prep pad to swab at least 1-inch border surrounding the skin outside of the drain sponges. Allow 60 seconds to dry. Place the 6x6 Driveline dressing over the drain sponges and gauze. Apply closure piece under the Driveline, but over the edge of the dressing. Place the Driveline back in the anchor stabilization device. It is best if the stabilization device is placed lateral to the dressing. New trauma or suspected infection. If drainage, redness, or swelling are present at the Driveline site, or if the patient had a drop of the controller, or the Driveline was pulled or caught on an object, the trauma pre-treatment should be started immediately and continue for 7 consecutive days. The pre-treatment steps consist of cleaning with iodine solution and 3% peroxide solution. These steps are added to the Driveline dressing change to decrease the chance of infection when the skin surrounding the Driveline exit site is broken or open. Use the System 1 dressing change kit and add these steps to sterile dressing field setup. Place the iodine and peroxide bottles next to the polymyxin bottle outside of the sterile field. Place 2 additional 4x4 gauze pads on the styrofoam tray. You will clean the Driveline site with the iodine and peroxide first in the following manner. Pick up the iodine bottle, pour a small amount of the solution into the trash can. Then hold the bottle 4 inches above one of the gauze pads and pour about a quarter-sized area onto the pad. Pick up peroxide bottle and pour a small amount of the solution into the trash can. Then hold the bottle 4 inches above one of the gauze pads and pour about a quarter-sized area onto the pad. Replace the lid and set aside away from the sterile area. Remove sterile gloves and put on a second pair of sterile gloves. A third pair of sterile gloves will be needed for the glove change before applying the LVAD dressing. Pick up gauze with iodine and clean around the Driveline site. Throw away the gauze. Allow to dry at least 60 seconds. Pick up gauze with peroxide and clean around the Driveline site. Allow to dry at least 60 seconds. Proceed to clean with ChloroPreps and complete the dressing as usual.